Welcome to The Pulse. My name is Brock Rapps. I'm the State Advisor for South Dakota HOSA Future Health Professionals. Today we sit down with Nancy, an OBGYN nurse from Avera Health.
Hi, my name is Nancy. I'm originally from Bismarck, North Dakota, and I knew in high school that I wanted to do something healthcare related. I wasn't entirely sure what that was going to look like. Initially, I thought nursing was not an option for me. I just didn't feel super interested in it. My mom was a nurse. And so I decided actually to go to college to get a degree in public health and exercise science. And then I worked for a few years training athletes, which was super fun, and I enjoyed it. But then as I got a little bit older, I thought, maybe I do want to do something different. Still stay in the medical field. So looked into a few different things, looked into teaching, looked into counseling, and then also nursing. So I ended up going back to school later in life, in my late 20s, as kind of a second career. I got a one-year bachelor's degree in nursing, and then started my career. My advice to you, especially as HOSA students, is to get as much experience as you can. Shadow different healthcare professionals, maybe even things that you don't think you'd necessarily be interested in, just to get a better perspective of what everyone does. When I was in high school, I didn't have an option like HOSA, and so I just kind of thought of doctor, nurse, pharmacist was really all that I really knew as far as medical field, and there's just so many more options out there. So I would just really encourage you to research it, ask questions, follow different people around, different professionals if you can, just to get a good idea, because it's what you're going to do for the rest of your life, so you want to enjoy it. I absolutely had doubts along the way, not necessarily with my first career field when I chose the public health exercise science. However, after I got out of college, it was tough to find a job. I was lucky enough to find one, but not everyone is so lucky. So from that standpoint, I was a little bit like, ooh, this is a good choice. As far as nursing, absolutely. First day that we were supposed to meet patients and do our first essentially clinical rotation, I was sitting in this room full of my classmates, and I started kind of panic, thinking, I don't want to meet patients, I don't want to go assess them, I don't want to go do anything with them, I just want to go home. And so I definitely had times where I was like, oh, this is the right decision, mostly because the whole traditional hospital nurse didn't appeal to me, and I knew that even going to nursing school, so a lot of people asked, well, good gracious, why would you go that route if you knew you didn't want to be a hospital nurse? But I just knew that nursing offers so many different opportunities outside of the hospital, and so that's kind of where I'm at now. I'm in a clinic and I love it, and I'm so glad I stuck with it and continued on the journey. The most rewarding thing for my career, I work as a registered nurse in a clinic with an OBGYN. So I see moms while they're pregnant, postpartum. We see women of all ages, from teenagers all the way through grandmas, dealing with any issues we deal with, like a female body part. So it's super rewarding because it's super fun, obviously, to see moms go through the process of becoming pregnant, having their baby, coming back and seeing us later. We get to see the little babes, helping people through really significant time in their life, a really emotional time, a really personal time, and getting to be a part of that is just super rewarding. Things I wish I would have known. I guess, when I was in high school, I thought of nursing as just being in the hospital, and that did not appeal to me whatsoever. Even when I said I went back to school later in life, I was thinking, oh goodness, I really don't want to be in the hospital. But as I got older, so I wish I would have known this in high school. I maybe would have chosen nursing to start with. I guess I don't know for sure, but just knowing that there's so many opportunities for nurses, it doesn't have to just be in the hospital setting. You can be in clinic, you can be in education, you can be in administration, you could work for the Department of Health, you could work in the school system. There's just so many different opportunities that nurses have once you have that background. When I was looking for jobs, when I was training athletes and I was kind of thinking I might want to do something different, was looking for jobs, a lot of the jobs that I looked at said they would prefer or require a nursing degree. And so that also kind of helped me, like, okay, well, just having that degree and having that knowledge is obviously something, and people look at that in a positive way, so you might as well get it. And so I spent 1 year in the hospital, and then I transitioned over to the clinic, and I've now been in the clinic for 8 years, and it's the best decision I've made, and I love my job, and it's great.